this is Dr. Al-Hassadi. Today we're going to be talking about asthma. Initially, I will show you what happened inside your lungs for you to understand how asthma attack happen. So as you see in this diagram, the lungs are made of pipes, and the lining of this pipe, which is the yellow part, is their mucous membrane. The problem with asthmatic that their bronchial lining, which is the mucous membrane, is highly sensitive and highly reactive. What that means? It means that every time they get exposed to a trigger like dust, pollen, which is common in spring season, smokes, mold, or virus infection like flu or COVID, they go through a chain reaction of closing down their bronchioles. And as a result, they become symptoms with cough, tiredness, and at times wheeze. Asthma can be an inherited condition, especially if you have a family history of eczema, hay fever, or asthma. There are different types of asthma. There is intermittent, there is persistent, there is mild, moderate, or severe. The treatment for asthma, in short, if you are asthmatic, you need to see your doctor regarding having an asthma action plan. The second is always trying to avoid the trigger if you can. The two main medications we use is a preventer and a reliever. So the reliever you use when there's a flare-up, and preventer is usually described by your doctor. Finally, hopefully that will help you to understand asthma and help you manage your symptoms when you have a flare-up. Thank you very much.